There is a lot of information about menopause and a lot of misconceptions. Should you take hormones or tough it out? Are hormones safe and which kinds are best? Do men go through menopause? If you or someone you know is going through the change of life, stay tuned. You're in the right place. You're listening to Healthy Looks Great on You, a lifestyle medicine podcast. I'm your host, Dr. Vickie Petz Kasper. For 2 decades, I practiced as a board-certified obstetrician-gynecologist, navigating the complex world of women's health. But life took an unexpected turn when my own health failed. Emerging on the other side, I discovered the transformative power of lifestyle medicine. Now, I'm on a mission to share its incredible benefits with you. So buckle up, because we are going on a journey to our very own mini medical school, where you will learn how lifestyle medicine can help prevent, treat, and sometimes even reverse disease. What do you think of when you think about menopause? A woman with a red face, fanning herself when the thermostat is set at 62 and you're freezing? Or maybe she bit your head off for no reason. If you said the latter, you're wrong, because there are lots of good reasons that menopause affects mood. Hot flashes are the most common symptom, affecting more than 75% of women. Some have it worse than others. And that red face, well, that's actually called a hot flush. A hot flash produces a feeling of intense heat, and a hot flush is when other people can see it. They don't last long, but they can be intense. I remember when I was a young gynecologist and my midlife ladies would tell me about their hot flashes, and I'd be like, yeah, I've had that too. And when I got a little older and wiser, I had a real one. You know how you can always remember where you were when major events happened, like 9/11? Well, I can tell you exactly where I was sitting, on my padded rolling stool, listening to a patient. Suddenly, I felt intense heat coming from within. I really tried to keep listening to her, but with the temperature, panic was also rising. I felt like I needed to take off my clothes and put my head in the freezer. I even thought I would spontaneously combust if I didn't. Now, that may sound dramatic, but it's how I felt. And I'm not alone. Many women feel dizzy, have an increase in their heart rate, or even palpitations. And often they break out in a sweat. Hot flashes and night sweats actually start before menopause as estrogen levels start declining. But hormones don't just drop off a cliff. They sort of wax and wane for a few years with a general downward trend. We call that perimenopause. The perimenopause is the transition time, and it usually begins between 4 and 8 years before the period at the end. Pun intended. Think of it like the previews when you're going to the movies. You know, kind of an advertisement of what's to come. But wait, there's more. When hot flashes happen at night, they often have a co-star. Night sweats. I'm talking the sheets are wet, your pajamas are wet, and you have to get up and change clothes. I don't know who coined the term change of life, but it's an understatement. Difficulty sleeping makes everything worse, and some women experience depression and brain fog. Short of depression, there are also emotional changes such as lack of motivation, difficulty concentrating or focusing, forgetfulness, anxiety, moodiness, from tense and irritable to downright aggressive. Often women say they just don't feel like themselves. Yeah, and they don't act like it either. At this point, you may be wondering if women survive this transition, or if you live with her, you may be fearing for your own safety. I won't keep you in suspense too long, but let's back up and talk about the different kinds of menopause. Yep, there are different types of menopause. And if you guys are feeling left out, I will mention Andropause in a minute. But for now, the women are center stage. Before we move on, let's talk about estrogen. It's important for cognitive function, and it also affects fat and fat distribution. So women who go through menopause tend to have more belly fat, and that's not good for your health. Collagen decreases, and that makes the skin become crepey. Even balance can be affected, resulting in falls, which can result in fractures because of bone loss. You can get joint pain, breast pain during those transition years, and menstrual migraines. So here's the question. Do you want to know what to expect or what to do about it? How long do the symptoms last? Well, could be a couple of years or maybe even 20. Today in mini medical school, we're going to go all the way back to birth. Not because once women complete the transition into menopause, they can no longer bear children, unless, of course, you're Sarah, Abraham's wife. No, it's because we're going to review the female reproductive system. Baby girls are born with all the eggs they'll ever have. On the other hand, men continue to make sperm their whole lives. So here's your vocabulary word for the day. Menarche. That's when a girl around the age of 12 starts having a menstrual cycle. If they're regular, then every month there are changes in estrogen and progesterone levels that result in the release of an egg. Now, this is an oversimplification, but since it's mini medical school, estrogen causes the lining of the uterus to build up in preparation for an embryo to burrow in it and be nourished. And if a woman doesn't conceive, then progesterone levels cause the lining to shed. That's the menstrual cycle. Now, tuck that information away because that's going to be important when we talk about hormone replacement therapy. The average age for menopause is 51, but that can be influenced by genetics and smoking. But if a woman functions exactly according to the package insert, she starts having periods around age 12 and stops around age 51. That's the average age for natural menopause. Now remember, I told you there are different types of menopause. Some women make this transition far earlier, and that's called early menopause, and we used to call it premature ovarian failure. This can just happen, or it can be caused by things like chemotherapy. And if a woman has had her ovaries removed, that's called surgical menopause. And depending on the age at the time of surgery, the symptoms can be way more intense because of the sudden withdrawal of hormones, and the implications for health can also be more significant. Note, now, just because you've had a hysterectomy, that doesn't mean your ovaries were removed. The lay terms are complete hysterectomy and partial hysterectomy, but those are not correct. When a gynecologist says complete hysterectomy, they mean they took out the uterus as well as the cervix, but not the ovaries. That's called an oophorectomy. I realize that's a technicality, but you came here to learn, right? Natural menopause is preceded by perimenopause. This is the time when estrogen levels are high sometimes, and sometimes they're low. It's not like there's a switch that turns off estrogen. It's more of a gradual process that begins about 8 to 10 years before menopause. The last 2 years are when the process accelerates and the symptoms get more intense. Menstrual cycles can be irregular during this transition, but a word of caution, you can still get pregnant. Now, I should probably define menopause. Medically speaking, menopause is when the ovaries stop functioning and menstrual periods have ceased for 12 months. At this point, the egg factory shuts down and estrogen levels are kaput. So listen, if you're older than 51 and haven't had a period in a year, you don't need your hormone levels checked. If you're old enough to be menopausal, you're old enough to remember Johnny Carson and the Great Karnak. He would take an envelope and put it on his forehead and pretend to be a mind reader. So here's the deal. If you come in and you're 63 years old, I can put an envelope on my forehead and tell you right now, you're menopausal. And unless you're taking hormone replacement, your estrogen levels are going to be zilch. Of course, if you want to have a needle stuck in your vein to prove it, that's up to you, but it's not necessary. After it's all said and done, we call it postmenopause. I think a better name would be permapause or menostop. Estrogen influences how your body uses calcium and cholesterol, so it has a protective effect on the cardiovascular system and strong bones. Women who are postmenopausal have an increased risk of heart disease and osteoporosis. So this change of life is also a change of health risk. Let's discuss that, then we'll dive into what you can do about it, both from a lifestyle medicine perspective as well as the pros and cons of hormone replacement therapy. First, a discussion about heart disease deserves an encore because it's the number one killer of women. Yes, even more than breast cancer. Before menopause, women are way less likely than men to have heart disease. but that's not true after menopause. Osteoporosis also deserves a starring role in this performance because when bones weaken and get brittle, they break. Older women who break a hip have a 20% chance of going into a nursing home and a 20% chance of dying. The first few years into menopause are a time of rapid bone loss in not only the hips, but the wrist and the spine. There'll be an upcoming podcast episode on osteoporosis. Less life-threatening, but not insignificant, are an increase in urinary incontinence, weight gain, and sexual function. Oh, the men are listening now. Loss of estrogen causes the tissues to be dry and lose their elasticity. When this happens to the face, it gets more wrinkled. But in the vagina, it causes the lining to thin out and have less rugae. Rugae are sort of folds in the tissue. Think of it like an accordion, which allows for lengthening. When the mucosa of the vagina is thin and dry, sex can be painful and even cause some little tears. And if that weren't enough, a decrease in hormones can affect libido and pleasure. But make no mistake, postmenopausal women can still experience orgasm. In the same region, the urethra is the opening to the bladder. And it's also affected by what we call atrophy due to loss of estrogen. When this tissue gets thin, it gets weaker, and that can lead to incontinence as well as urinary tract infections. There will be an episode on that as well. So now is probably a good time to mention that if you don't want to miss upcoming episodes, either follow this podcast on Podbean, Spotify, or Apple. Better yet, sign up for the email list. I'll put a link in the show notes. You can click that, enter your email address, and I'll just send you every episode right to your inbox on Fridays. Now that we've covered what's happening on the outside, let's look at the inside. It's not better. Metabolism slows down, and women tend to gain weight, especially in the belly, which of course is terrible for your health. Also, muscle mass decreases. So this change of life requires a change in habits to just maintain the status quo. We're going to get to some of those tips soon, but first, open wide. Yep, your teeth and gums are also affected by the hormonal changes of menopause. Dry mouth, sensitive teeth and gums can cause cavities and gingivitis. And oh joy, dryness also affects the eyes. So how do we get out of this desert wasteland? Well, since this is a lifestyle medicine podcast, let's start with that, and then we'll talk about hormones. For hot flashes and night sweats, think about triggers and how to avoid them. Be your own detective. It might help you to keep a journal. You know, I always say it's a cheap psychiatrist anyway. Wear layers of clothing and layer the bed covers so you can peel and throw them off and on, because once you're drenched, you may wake up freezing. And throw away your flannel pajamas, but keep the bedroom cool at night. You can even put a fan on your nightstand along with cool water so you can sip it in the heat of the moment. They make sheets and pillowcases and PJs that wick moisture away. And you can even get a frozen ice pack and put it under your pillow so you can turn it over when you need to chill out. This works for your feet too. Weight loss helps, but as we discussed, the tendency is in the opposite direction, which only makes everything worse. So if you're listening to this and you still have your fountain of estrogen, pay attention to diet and exercise now, before the transition. And don't smoke. This goes for everyone, but it makes hot flashes worse, and it definitely increases bone loss and the risk of heart disease. And yes, I know, like diet and exercise, it's not that simple. Spicy foods can turn up the heat, so think about that the next time you order a dish with 3 peppers beside it on the menu. You may want to drink ice water instead of a warm cup of tea, and caffeine and alcohol can intensify the symptoms, especially at night when it comes to sleep. If you're having trouble falling asleep, make sure you go to bed and get up at the same time every day. Yes, even on Saturdays and Sundays. And whether you're menopausal or not, it helps to have a wind-down routine. Read a relaxing book, listen to soothing music, take a bath, turn off the screens, drink chamomile tea, dim the lights, and keep the bedroom quiet. And certain foods may help. Tryptophan relaxes the body, and it's found in peanuts. A diet rich in phytoestrogens may also help reduce symptoms. Now, open up your Greek dictionary and look up the word phyto. Never mind. I'll just tell you, it means plant. So yeah, there are some plants that contain compounds that are similar to the female hormone estrogen, notably soybeans and soy products, including tofu, tempeh, and soy milk. Also edamame and miso. In general, nuts and seeds, but especially chickpeas, lentils, sesame seeds, and the very best are flax seeds. Also grains, beans, fruits like peaches, apples, berries, grapes, and pomegranates. Dried fruits are okay too, like apricots and prunes. Veggies such as carrots, spinach, any leafy green vegetables, broccoli and cauliflower, and be generous with your garlic. So, is there such thing as a menopause diet? Well, I'm glad you asked. While there's not a particular diet like the DASH diet for hypertension or the MIND diet for cognitive impairment, it's generally recognized that things like the Mediterranean diet are anti-inflammatory and loaded with nutrients. This diet is rich in fruits, nuts like walnuts, and vegetables, as well as olive oil. And it's not entirely plant-based, but it does emphasize fish instead of red meat, especially fatty fish, which are high in omega-3 fatty acids. And since bone loss accelerates during menopause, it's super important to get an adequate amount of calcium in your diet. You can get those from low-fat dairy, or if you're eating plant-based, try plant-based milks. Broccoli, okra, and green leafy vegetables are good for that too. Seafood also contains calcium. And what about men? Should they eat foods with phytoestrogen? Well, they're super healthy, so yes, and research has not shown any adverse effects. So everyone's diet should be made up mostly of whole foods, not processed. Men and women need to eat at least 5 servings of fruits and vegetables a day. And remember, variety in color is key to getting all the vitamins and minerals you need to protect things like your heart. Okay, since I mentioned men, let's go ahead and talk about that. Do they go through menopause? No. Menopause literally refers to the menstrual cycle, so it's women only. But what does happen is andropause. And some people do call it male menopause because, well, it's just a term everyone is more familiar with, but it's still technically very incorrect. Anyway, the male hormone testosterone drops off much more gradually in men than the female hormone estrogen does in women, but it does decrease by about 1% a year. So they may not notice as much as the years go by, but low testosterone levels can cause fatigue, moodiness, changes in body composition, and decreased sex drive. But again, it's a slow, steady decline, not dramatic like menopause in women. But they can even have hot flashes and insomnia. And while the men are tuned in, let's go ahead and talk about sex a little more. Men may experience decreased libido and erectile dysfunction. Women have vaginal dryness, which can cause pain with intercourse. Using a water-based lubricant is best. I'm saving the discussion about hormone replacement therapy, but there's also laser therapy. And guess what else? Use it or lose it is a true statement. Women who can have painless sex on a regular basis maintain healthier vaginal tissues because of increased blood flow. Now, shifting gears just a little toward the front, let's talk about urinary symptoms and pelvic floor function. There are different types of urinary incontinence, and we're going to discuss those in an upcoming episode of this podcast. But estrogen affects them all. Of course it does, right? If you have a weak pelvic floor, then you need to try and strengthen it. Again, if you're years away from menopause, start now. Kegel exercises help keep the bladder, rectum, and uterus right where they're supposed to live. And that can help with stress incontinence, which is leakage of urine with cough, sneeze, or laugh. To get started, try to stop the flow of urine. Okay, now, that's the muscle you want to exercise. And once you've got the hang of it, you can do it anywhere, and no one will even know. Your belly shouldn't move, your legs shouldn't move, so no one should be able to tell that you're doing them. And since it requires a lot of repetitions to work, I think it's helpful to find something you do several times a day and add your Kegels to it. For example, if you have a schedule for checking your emails or you drive a lot and stop at red lights, Squeeze that muscle 10 to 15 times and hold it for 3 seconds. If you need more help, there are actually weighted cones that can be used. It's kind of like weightlifting for the vagina. Also, some physical therapists are trained in pelvic floor strengthening, and that can help a lot. Now, it's super important to stay hydrated, but overhydration can cause urinary frequency and leakage when the bladder is too full. And things like caffeine and acidic foods can irritate the lining of the bladder and worsen urgency. And speaking of exercise, all that hot flashing and sweating can make it challenging. But exercise is an essential part of maintaining postmenopausal and overall health. Because remember, once the change of life happens, the risk for osteoporosis and cardiovascular disease go up, as well as the tendency to gain weight in all the wrong places, which increases the risk for type 2 diabetes. Exercise also boosts your sleep ability and mood. Staying fit helps manage stress too, especially things like yoga and really any activity that helps you relax. And stress makes hot flashes worse. And of course, it doesn't do much for moodiness either. Hormonal fluctuations can make women feel out of control, anxious, irritable, and downright depressed. Managing stress is the same whether you're postpartum or postmenopausal or just plain overwhelmed. Exercise can help. So can massage, listening to music, or creating things like art, music, writing, planting. Nature soothes the soul, and prayer nourishes the spirit. Counseling may be needed, but please, if you're listening to this and your mom, your sister, your aunt, or your wife is suddenly out of sorts and around 45 to 55 years old, be understanding. Hopefully by now it's clear that although this is a perfectly natural occurrence, that doesn't mean it's easy. I mean, seriously, the hair on her head may get thin, and then it might sprout right out of her upper lip. It's a big deal that menopause alters the balance between estrogen and testosterone, and that causes facial hair. There's an entire industry of lasers and such to get rid of it. Things like this are important to discuss so women don't feel alone. Social isolation is the worst thing to do during the change of life or any other time of life. It may even help to join a support group so you can talk to women who are right where you are and get it when no one else seems to. This can be a safe place to ask questions and express emotions, and there are many online groups available. Staying socially active is as important as staying mentally active. If you're having some trouble with your memory, be sure and don't veg out in front of the television. Instead, do something that challenges your brain. Like sex, if you don't use it, you lose it. So stay mentally sharp by learning something new. Hopefully by now you're wondering, if there's this much going on, is it safe to take medications if changes in diet, exercise, support groups, and stress management aren't enough? I'm so glad you asked, and I'm going to give you some answers to the questions I asked at the beginning. Should you take hormones, and if so, which kinds? If you're going to learn about medicine, then we have to go back to mini medical school. We've talked a lot about estrogen without talking about where it comes from. The other main female hormone is progesterone. They cycle in waves to cause that lining of the uterus to slough off. It's called the endometrium, and it builds up every month just in case that egg gets fertilized. Then the body has a nice, blood-rich, fluffy place to nurture an embryo. The hormonal cycle continues if pregnancy doesn't occur and the lining sloughs off. That is the menstrual period. And all of this is regulated by FSH, or follicular stimulating hormone, which is actually made in the pituitary gland in the brain. And it operates on a feedback loop. So if FSH levels are high, that means estrogen levels are low. Some doctors will check an FSH level to see if you're menopausal. The levels should be really high in menopause because the brain is screaming at the ovaries, "We need more estrogen." And the ovaries are like, "Nope, this factory is permanently closed for business." You can have blood work done to test your hormones, but remember, if a 51-year-old walks like a duck, talks like a duck, sweats like a racehorse, and hasn't had a period in a year, she's menopausal. There are 3 types of estrogen made in the body: estrone, estradiol, and estriol. Estriol is most predominant during pregnancy. Estradiol is captain of the ship during the reproductive years, and estrone takes command during the postmenopausal years. The vast majority of estrogen and progesterone are made in the ovaries, specifically in something called the corpus luteum, which is kind of like this little space that gets left behind when the egg is released every month. In fact, if you do an ultrasound around this time, it even looks like a little cyst, but it's perfectly normal. And then the adrenal glands, which are the two little triangular glands that sit on top of the kidneys, make a lot of hormones and chemical signals that include a little bit of estrogen and progesterone. In fact, there's even a tiny bit of estrogen made in the male testes. Additionally, estrogen is made in adipose tissue, and the more you got, the higher the estrogen levels will be, and that can be a problem. Because too much estrogen and not enough progesterone can cause all kinds of problems. In fact, in the postmenopausal years, it can even cause endometrial cancer. That's why women who are overweight or obese have an increased risk of breast and uterine cancer. It's also going to be important to understand hormone replacement therapy. Now let's pause right here and make an important distinction. There's hormone replacement therapy, and then there's estrogen replacement therapy, previously known as HRT and ERT, and now they just call it MHT, which is menopausal hormone therapy. Do you know the difference? Well, estrogen therapy is easy. It's just that, treatment with estrogen. So what is hormone therapy? It's estrogen and progesterone. Now, I mentioned that progesterone is important to keep the lining of the uterus from building up too much and counteract estrogen to prevent uterine cancer. So if a woman's going to take estrogen and she has not had a hysterectomy, then she has to take progesterone too, and that's hormone replacement therapy. On the other hand, if a woman has had a hysterectomy with or without removal of the ovaries, then she can just take estrogen and not worry about uterine cancer because she doesn't have a uterus. Got it? I know you're ready to move on, but first we've got to go back in time to 1991. Unlike the Challenger explosion, you may not remember where you were when the preliminary results of the Women's Health Initiative caused the FDA to halt the study due to an increased risk of breast cancer. This was big. Before that, I remember trying to talk my mom into taking hormones to protect her heart, brain, and bones. Then suddenly they said, yeah, it's good for your bones, but maybe not the heart. Fast forward 2 decades, and we know so much more, but maybe not what you think. The Women's Health Initiative, or WHI, was a big study, and it was designed to prove that hormone therapy and estrogen therapy prevented heart disease. They stopped the study early because one arm of the study showed an increased risk of breast cancer, and that was the hormone replacement therapy arm. The women who were taking estrogen and progesterone and had not had a hysterectomy. So why did they stop both arms? Well, it seemed that the estrogen therapy arm didn't prevent heart disease. Gosh, the hormone therapy arm even had an increased risk of heart disease. But the estrogen-only arm of the study never showed an increased risk of breast cancer. That may surprise you. But headlines and lawsuits followed, and women stopped taking hormones. In fact, hormone use plummeted by 80%. But that's not the end of the story or the study either. They kept dissecting the data, and they learned some very important lessons. In this study, they were using conjugated equine estrogen, or CEE, and medroxyprogesterone acetate, or MPA. In simple terms, the source of estrogen was pregnant mares, hence the term equine. Yeah, I said horses. And synthetic progestin. But that wasn't really the problem. The real problem is they started women on either hormone therapy or estrogen therapy at an average age of 62. Like, who does that? In the real world, doctors were starting women on hormones during menopause when they had their own personal fans and their pajamas were soaked. And by now, you know, that would have been around age 51 when tempers were rising and libido was dropping. And remember, that first year after menopause is when bone loss recurs at a rapid rate. So now we know if you just sit around and wait 10 years after a woman and her friends and family have toughed it out, then starting hormones is not really a good idea and can actually increase the risk of heart disease. Now, after many years of study, we know that hormone therapy may in fact slightly increase the risk of breast cancer, but estrogen therapy does not. So it's not really fair to just blame estrogen for causing breast cancer. Does it feed it? You bet. Does it cause it? Maybe, but maybe not. Now, if you have cancer cells lurking in there, estrogen is like Miracle-Gro. So whether you're taking hormones, considering taking hormones, or staying 10 feet away from hormones, all y'all should have a mammogram, according to the guidelines. It literally saves lives. Now, women with a history of breast cancer or who are at a high risk for breast cancer should avoid hormone therapy and estrogen therapy and just stick to lifestyle changes, such as what we discussed with diet, exercise, stress management, and social support. And certain antidepressants can help too, as well as some new medications. The possible exception to this no estrogen rule is low-dose vaginal estrogen cream. Now, if you ask your oncologist, they'll probably say no estrogen at all. You know, they're used to giving people treatments that make them deathly ill, so they're not really too worried about your dry vagina. But your gynecologist and your urologist feel differently because they're more focused on quality of life. Nothing against oncologists, it's just a different perspective. Now, since I mentioned cream, I also want to mention that hormones can be delivered in various pills, potions, patches, gels, creams, rings, and even pellets. In the big scary study, they only used things that were swallowed. And now it seems like transdermal ends up being safer for the heart. Trans means across, and dermal means skin, so that means patches and creams. Also, since the Women's Health Initiative study, the preference is now for lower doses and for 17-beta estradiol instead of conjugated equine estrogens. Now, this is your term for the day, bioidentical. It's important. It's better. It means it looks like the estrogen that your own ovaries make during the reproductive years. And guess what? You don't have to get it compounded. It's commercially available. Your doctor can write you a script or send it in electronically. You can go to your pharmacy and hopefully your insurance will pay for it. Bioidentical does not mean compounded. 17-beta estradiol is available in commercial preparations from the pharmaceutical companies. I'm going to bet you might not have known that. In fact, the only hormone you have to get mixed up the old-fashioned way is testosterone. The FDA has never approved the male hormone testosterone for use in women, even though there are many studies that show a low dose is safe and effective to enhance sexual function and desire, as well as energy levels and an overall sense of well-being. Now, progesterone also comes in several forms. In addition to creams and pills, it comes in an IUD, an intrauterine device. Natural progesterone instead of the synthetic is probably healthier for both the heart and breast. And remember, any woman taking estrogen who still has a uterus needs progesterone. Again, the exception is low-dose vaginal estrogen cream. Now, what about black cohosh and other herbal remedies? Not much evidence that they work. And there's also not any research that shows that compounded hormones are better than pharmaceutical brand names. Because again, both can be bioidentical. Okay, that's a lot of science. No wonder it's confusing. I know you have a lot of questions about menopause. I hope you find a lot of answers in this podcast. But if you are specifically interested in menopause, then you're going to want to sign up for Menopause Answers. You'll get a free downloadable FAQ sheet and some videos to answer the questions that you've been asking on Facebook. As always, there will be a sign-up link in the show notes. But I know that right now the question you're asking is, should you take hormones? Well, I can't answer that for you. But now you have a lot more information to make that decision with the help of your healthcare provider. Here are some guidelines, though. If you are having menopausal symptoms and you have more than a 10% risk of heart disease in the next 10 years, or more than a 1.67 to 5% risk of breast cancer in the next 10 years, then the answer is probably not. Women who have a moderate risk of heart disease, like 5 to 10% in the next 10 years, should use transdermal rather than oral estrogen and micronized progesterone rather than a synthetic progestin. And there are calculators to figure out those numbers, but of course, they aren't perfect. Again, they're just guidelines. And as a general rule, women with high triglycerides or a sick gallbladder or certain clotting disorders should not take pills with estrogen. And if we want to talk about headaches and blood clots, in the past, this was a big no-no for hormone therapy. Now, it's not an absolute contraindication because the risk of stroke and clot is pretty low in young postmenopausal women. And mostly, I'm just glad we can say young and postmenopausal in the same sentence. In the end, the FDA says when it comes to hormones, the lowest dose for the shortest period of time. So again, should you take hormones? The answer is no if you've had breast cancer, heart disease, a blood clot, stroke, active liver disease, or uterine cancer. Otherwise, you're going to have to talk to your healthcare provider. And with any medication, there are always benefits and risks, and it's never black and white. Practicing medicine is far more complex than most people realize because, well, humans are far more complex than we realize. But most professional societies who study all this data believe that menopausal hormone therapy is safe for young, healthy, symptomatic women within 10 years of menopause and younger than the age of 60. I probably should have called this episode Menopause the Movie. And whether you're the star of the show or a supporting actor, it may not be a comedy, but it doesn't have to be a horror show. And laugh anyway, because laughing is good for your health, and healthy looks great on you. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.